Hey guys, happy Friday. This is take 2. We are today celebrating National Women Physicians Day. So to all my colleagues, my mentors, anybody who's out there, woman physician, congratulations to us. Yes, we're celebrating. It's a wonderful day, inspired by the work of many women who came before us and really fought for our profession and for us having a place at the table. And I remember, being inspired by, when I was younger, by all these women physicians that I saw in Puerto Rico. There were many that I saw growing up. I did see like a gastroenterologist and I saw a dermatologist, and they were so cool in their high heels, always on the go, taking care of patients. So that was inspiring to me, and then now I can say that I'm one of them. So happy National Women Physicians Day, and welcome to this episode here of your Fridays in your Maxillary Week. As you know, we do this in support of our Maxillary Mastermind. We're very excited because next week we start with our next session. We have wonderful physicians who are going to join our Maxillary Mastermind. We don't take more than 10. We have people who are going to come from Hawaii all the way to Puerto Rico, from Florida, different states, and we're very excited about that. Today we're going to be talking about exosomes, bringing exosomes to your practice, and we have Dr. Ed Park who's going to join us shortly. We're very happy. If you haven't seen the episode this week in Design Your Physician Life, it's our podcast, and he was a guest in our podcast telling us a lot about exosomes, how he found them, and how he's been using in his practice. I've been using regenerative medicine for over 10 years myself. Well, no, not over 10 years, close to 10 years. And it's been great to me to see how we can find healing within ourselves. So there's something called PRP, which is platelet-rich plasma, and the so-called stem cells as well, which these days we just call them, different names here in the United States. But they're basically used with a similar intention of causing rejuvenation and helping us with healing. And when these are not an option, one of the most recent options, the technology has been developed, has been to bring exosomes, which are some vesicles that are secreted by the stem cells, which usually help in spreading cells through our body. And we have Dr. Ed Park, who actually goes around the United States and more, teaching about these cells and how he does it in his practice. And why are we talking about this when we're giving entrepreneurial tips? It's like we want to talk about ways of bringing technology to your practice. When do you do that? I know I've been in different types of practices, and I've been in practices when technology is brought like immediately. You see something new and then you bring it, and then you bring it to your patients. And then we've had some other practices where they've been more cautious, like it has to be a long time before that procedure, whatever it is really proven, before they would consider that for their patients. So there's different ways of approaching technology into your practice. And I really wanted to talk about exosomes today because it's really intriguing to me. Having done regenerative medicine for some time, having this ability to have some healing in a little bottle like that, it comes from there they are. Hello, welcome. Let me know. Let's see. Is that Dr. Ed Parks? I cannot see you. So if it's Dr. Ed Parks, just go ahead and ask to be joining, and then I'll bring you into the transmission. So it's from placental tissue, the one that we're getting. So we know that there's been some research that shows, for example, if you have some rats that are older and then you have some rats that are younger, and then you exchange blood from those, that they can show either reverse or regression. Either like the younger get older in terms of their markers, and then the older get younger in terms of their markers. So it's like some rejuvenation and then some advance of their chronological age in terms of their markers. So it's very important that we learn about these things, because then we can offer them to our patients, and then we can also see how we evaluate not only this therapy but other technologies to bring our patients, expand our offers, and then see how we can continue to practice for joy and not for need. I'm here waiting. I did not want to talk a lot more about exosomes myself because I'm waiting for Dr. Parks to join us. It seems that today is going to be a challenging day for that. Actually, it's, besides that it's raining a little bit, it's pretty, it's beautiful out here. And, we don't have as much snow. We don't have any snow, right? As they do in other parts right now. So despite the little rain, we're here. Let me see. Yes. Hi, CJ Johnson. It says CJ Johnson. I'm wondering if this is Dr. Parks who's using a different phone. If you answered yes to me to that, then I'll join. I'll have you join our transmission here. If not, welcome to our transmission. We're waiting for Dr. Ed Parks to join us so that he tells us more about exosomes. And we're talking about this because it's a technology that we can bring to our practices. And not only does Dr. Parks does it where he lives, he actually travels around the United States to different states taking these therapies to others. He also teaches about them. He has a course, and he has discounts if you want to bring your therapy, this therapy to your clinics. So exosomes helps us in rejuvenation. We can use them in different areas. We can use them in aesthetics. We can use them in neurological problems, nerve damage. We can use them for different joints, tendons. And if you haven't really heard our podcast, go to the podcast from this week, Design Your Physician Life, Exosomes, bringing exosomes to your practice with Dr. Ed Parks. I think for today, we might have just to invite you to our podcast. Like any other therapy, I recommend that you do different things before evaluating a therapy for your practice. So it's important that whatever we're doing, first do no harm. So we might bring things that are considered experimental, but as long as no harm has been shown and there's a clear understanding of that patient, that these are things that are not necessarily approved yet, that we do things that are reasonable for those patients. I remember patients having so many patients in pain telling me, I'll do anything for you to take this pain away. I say, okay, you know what, we're going to do anything that's reasonable to help you with that condition, because the last thing that we want to do is do something that will cause them harm. So first, when you're evaluating any therapies, make sure that you have enough information that's going to be safe for your patients. There's going to be consents that you're going to have to develop. Hopefully there's going to be some research behind it and some other people that you can work with. You know what? I don't know. I'm going to bring CJ Johnson here. I don't know if this is Dr. Ed Parks, but I'm bringing you in and accept it, and then we can chat here in this National Women Physicians Day that we're celebrating. I'm talking about exosomes and bringing technology to your practice. So first, knowing what the technology is, having some research, having things that are going to be reasonable, making sure we're not going to do harm, making sure that we have the right consent for the patients, and the way that we advertise things is very important, because we don't want to advertise things that are going to be false advertising for our patients, for our expectations, and the patient's expectations, right? If we want to improve function or looks or whatever it is, we cannot necessarily ensure the results if things are new as such, but we can say what in our experience as physicians we've done and we've had. Whenever we bring these new technologies, we want to make sure as physicians that we are really following some protocols so that we're really not abusing therapies, and then we take them out of use, right? Because if we use things when they, like as a blanket or as a, just, when you have one hammer, you just use the hammer for everything. That's not the way to use therapies for our patients. So it's important that if you're really not sure about those results, that you communicate that with the patient and then keep track of that, so that then you can report that to the medical community. Let me see. I'm trying to see. So KK is here, CJ Johnson. Hi guys. And then I don't see Dr. Parks here. But if you're here, remember to go and see the podcast, Design Your Physician Life, where he talked to us a lot more about that. In terms of bringing technologies, one of the things that I really liked about this story with Dr. Parks is that when he was curious about it, he went to learn about it. And not only that, he said, you know what, I'm really curious about this therapy. I'm going to try it on myself. I'm going to try it on my family, because he believes so much in it that he decided to make change close to home first. And then once he started having some of those results, great results with his patients and testimonials, then from there he went on to friends, and then he went on to offer it to his patients. So it's a way that you can use if you're considering some new technology. I have some other friends, for example, who have done instruments and have developed different products for their medical practices, and then once they prove that has helped them in their medical practice, then they're able to develop those products and take them to other patients and to other practices, and then go around the United States and even further around the world, teaching those techniques and helping those patients with those new either products or services that they offer. Okay, here we go. Ed Park is telling me that he doesn't know how to jump in, and I'm trying to do that as well. So guys, here, let's try this. So guest reviews, your viewers, for some reason it doesn't recognize you as a, it doesn't recognize, why can I see everybody else and accept you to join you here? Like, I have all these other people. Maybe, I don't know, this transmission doesn't like you for some reason. Let's see. So see, like CJ Johnson says, bring them in. KK, bring them in. And then Ed Park, nothing. Let me try that again. So I'm asking, so guest requests. Let me see guest requests again. And then it's like, as if it doesn't have you as a viewer. As we say in Mexico, ni modo, ni modo. Well, we're trying really hard. Let's see. Okay. I could write a comment. I don't want to write a comment. I want to really bring you in, and it's not allowing me to. So you know what? What we can do then maybe is just do a little recording and then post it later. Oops. If you're available, we might have to do that. So what I'm going to do is that right now I'm going to stop talking here, guys. I want to stop the transmission. Then I'm going to try to get Dr. Parks in a different little transmission and then get that for us shortly. So thank you for being here. Happy Women Physicians, National Women Physicians Day. Thank you for all that you guys do to help each other, help other doctors, help your patients and your families. I'll see you then. Have a